Start.
السلام عليكم ورحمة الله وبركاته. إن الحمد لله نحمده ونصلي ونسلم على رسوله النبي الكريم. أما بعد, respected brothers and sisters, Jazakumullahu khairah for joining us here at the masjid and also online. As per the advertisement and the announcement after Salat al-Maghrib, today's program is going to be focused upon brothers and sisters fasting or not, having medical issues, whether they are related to cardiovascular disease, blood pressure, diabetes, or anything otherwise. So we will be dealing with this from two aspects, from the aspects of Sharia and also from the aspects of medical professionals. So we have with us Mufti Sarfraz Muhammad, who's going to be first, who's going to go through a series of slides with yourselves with regards to general guidelines for people. You probably got all these questions about whether you can fast if you're using an inhaler and all sorts of things, injections and letting blood, etc. So he's going to be going through some guidelines with regards to that. And then we have Dr. Atiq Sayyid, who's a consultant endocrinologist in one of the local university hospitals in Birmingham, and he's going to be going through the medical aspects and providing some guidelines. And then we're going to have an open forum of questions and answers at the end, inshallah. And for the brothers and sisters online, we've made the live chat function available. So if you've got any questions, in the dedicated question time, if you could make your questions known, and we will try our best to relay them over to the presenters, and the questions will be addressed. Jazakumullahu khairan wa ahsan jazak for your undivided attention. So Mufti Sarfraz Muhammad, just briefly, he's not a stranger, he's been here a few times before. He's from Birmingham, and he's one of the senior muftis in Fiqh Council Birmingham, and he's had the privilege to study with specialist muftis from around the world, particularly Mufti Taqi Uthmani, who's on various international iftar fatwa forums, and he's specialized in medical fatawa particularly, and his dissertation is based upon that, and I'm sure he'll be able to share so many things from there today in his presentation and answering questions. Jazakumullahu khairan.
الحمد لله وكفى والسلام على عباده الذين اصطفى أما بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم كتب يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون صدق الله العظيم وصدق النبي الكريم ونحن على ذلك من الشاهدين والشاكرين والحمد لله رب العالمين. Firstly, elders, brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah, Allah has blessed us with the opportunity, inshallah, of reaching Ramadan, and the Prophet sallallahu alaihi wasallam would make special supplication and dua at the time just before Ramadan that we all are enabled to reach it, and he would make that dua, and we should do so likewise. As we are well aware, we live in times where, there's been a global pandemic regarding COVID, and many people have lost family members, friends, relatives, etc. Even our beloved Ustad Mufti Abu Zafar, rahmatullah alayh, passed away a few months ago, and he was for about 30 years the Imam of a local mosque here in Birmingham. And likewise, one of my teachers in Darul Karachi, Mufti Mahmood Ashraf, and he was Mufti there for about 25 years, and he just passed away a few weeks ago as well. So we're losing people, and this is a reminder that there's no guarantee we will reach Ramadan. So that's why we make the supplication that Allahumma ballighna al-Ramadan, that Allah enable us to reach Ramadan. Our presentation today is hopefully going to give you some information on the guidelines from the Quran and Sunnah regarding fasting. The issues are clear in the Quran in a number of respects, but the detailed rulings are clarified by the scholars. So the first port of call for us is the Quran, and the verse I recited at the beginning, Ya ayyuhalladhina amanu kutiba alaykumus siyam, is very important because it lays the context. Firstly, Allah subhanahu wa ta'ala addresses the believers. When we want to respect somebody in modern day world, we say, Your Royal Highness, Your Right Honorable person, such and such. Allah subhanahu wa ta'ala wants to honor the people He is addressing. So He says, Ya ayyuhalladhina amanu. Oh, you have believed. Oh, you have believed. So He's saying to all the Muslims that fasting is linked to belief straight away. And then Allah subhanahu wa ta'ala uses a very interesting term to explain the importance of fasting. He says, Kutiba alaykumus siyam, that literally the fasting has been written down. And when we want to emphasize something, we have a phrase in English as well, that let's put it in writing. When you have an agreement, just in case the person thinks this is not for real or maybe there's some doubt, you say put it in writing. And so Allah subhanahu wa ta'ala says, Kutiba alaykum siyam is written down, prescribed that you will fast. And that is the month of Ramadan. And on the screen there, that verse from Surah Al-Baqarah emphasizes the fact that this is an obligation on every person, Man shahida minkum shahra falyasum, that whoever witnesses the month, and inshallah Allah subhanahu wa ta'ala enable us to reach there, that you have to fast. As well as mentioning the obligation of fasting though, in Allah's infinite wisdom and mercy, in the same verses regarding fasting, He also mentions the exemptions to fasting. Man kana minkum maridan, the person who is ill, aw ala safar, the one who is traveling. So today we will talk about the exemptions. We'll give some guidelines on the laws generally, and then the exemptions, especially related to medical issues. And we're fortunate also, Dr. Atiq is with us as well. He will be able to shed light, inshallah, on some of the points where you could say the rulings overlap with a person's medical health. And I'll explain as my presentation goes on where that fits into the Sharia. Where does the role of the tabib, the doctor, physician, fit into the ruling in the Sharia? So this is important to understand, and I'll cover that briefly as well. I will also, inshallah, look at some of the masail, detailed rulings, regarding fasting, in the sense that people can misunderstand what the exemptions are and where there isn't an exemption. So I'll try and cover that briefly, and then if there are questions, inshallah, we can take them from online, and likewise those who are present, they can forward their questions and we can deal with that in the Q&A section. So if we go to the slide here, which mentions the prescription, all Muslims are required to fast in the month of Ramadan. Okay, the slide may not have moved yet, so I'll request the brothers who on the technical side, if they can just check the slides are moving. Let me just see if I can try that. No. Okay. No. I think maybe Hafiz Ishaq might need to check on the technical side. The slide is an aid to follow the presentation, and so it's good if you can work. won't work. It's okay, I can just click down. Okay, Bismillah ar-Rahman ar-Rahim. So we were mentioning the fact that the obligation is upon all Muslims based on the verse from Surah Al-Baqarah. And the background to fasting is that the Prophet ﷺ in Makkah al-Mukarramah was teaching the Muslims the basic beliefs and the salah in a basic way. But when they came to Medina al-Munawwara, more detailed rulings came, including amongst them was the fasting. At that time, the Jewish community would be fasting on the day of Ashura at that time, and the companions were advised by the Prophet ﷺ that also fast that day, the 10th of Muharram, and the Muslims fasted that day. Then later on, then the ruling of Ramadan and fasting in the month of Ramadan came, and that became the obligation. And then the previous obligation of Ashura, 10th of Muharram, became something which was mustahab, recommended to fast for the Muslims. So that's a bit of background on the fasting. And the fact that it's a pillar of Islam is well known. Bukhari and Muslim mention the same point. So this is how to emphasize it for our community, especially the younger ones. The Sahaba, radiallahu anhum, their children would fast. Even though it was obligatory, their children would fast. Why? Because it trains them up to fasting. And I know people sometimes complain in the primary schools and things like that. Look, the child is maybe like 8, 9 and they want to fast. I remember my own family, when we were kids, we'd love to fast, even though you're in primary school. And the Sahaba radiallahu anhum, just to give you an idea how young the kids were, they would say the child would start crying and they would give them a toy so that the child becomes distracted, and then they would complete the fast. So it's a kind of training even for the younger ones who are not required to fast yet. So this is why it's so important that this is a foundational pillar of Islam. So even for the younger ones. As for the objective of fasting, this is important to understand, because if you have this objective in mind, you can understand when we discuss medical issues. Because the objective is that you are attaining proximity to Allah subhanahu wa ta'ala. لَعَلَّكُمْ تَتَّقُونَ is the verse I recited at the beginning, that you attain taqwa. And the ulama mentioned that the fasting also enables you to appreciate gifts that you've been given but haven't appreciated really. One of the food and the drink that you have. And marital relations, all these are prohibited in the daylight time in the month of Ramadan. And when you lose that, opportunity for eating and drinking, for example, you become grateful for that. You feel it physically. And the ulama mentioned that when something is missing, that is when you start appreciating it more. And I've discussed the point on taqwa, that attaining proximity. How the ulama explain that is they say that in the month of Ramadan, halal things are prohibited. It's halal to eat food, which is halal, and to drink. But in Ramadan, it's not permissible for you in the daytime. So these are halal things which you are doing, abstaining from. So therefore, after Ramadan, you've been trained to avoid even the halal in the daylight hours. Then after Ramadan, you will be more sensitive to avoiding the haram. And avoiding the haram and the prohibited things, that is the attainment of taqwa, that you fear that you might do something which is wrong. Because you've been trained to even avoid things which are normally halal. After Ramadan, inshallah, you will be more sensitive to avoiding the haram. So this is how it helps your development of taqwa. And the fada'il are many, the rewards for the fasting. Just mention one from the narration of Bukhari and Muslim, that the people who are known for fasting, as-sa'imun, they have a special door to enter into paradise. And from that door, the person, only the ones who are fasters, those who've been fasting, and obviously there's the sunnah fast as well as the one which is obligation in Ramadan, Mondays and Thursdays, etc. That is for the sa'imun, those who would fast in the dunya, they will enter that door of paradise, known as Rayyan, which literally means that the person will be free from thirst thereafterwards. And I mentioned the sunnah fast. for another reason as well, which is that people say that, you know, in the summertime, all of a sudden to fast might be difficult. But if you've been doing the sunnah fast, which is Monday and Thursday, even if it's irregular, then the month of Ramadan becomes easier for you. Because people say, you know, I've got exams, I've got this and the other, and it takes a toll. But the reality is, if you've been fasting, say, before that, it's like a training. If somebody's going on a marathon, they don't just turn up and start running in the marathon. They train before. So what you can do is, especially if you've got exams in the summer months, or that time in you know, May or April, May, then you should try and go before the obligation of the fast and do the sunnah fasts. So it builds up your stamina for fasting. So this is one of the benefits of the voluntary fast. We mentioned the verse about the you know, the necessity of fasting. The ulama also mention here, Ibn Kathir, that Laylatul Qadr has got a special significance for the Muslims, and the khatam of the Quran, the recitation of the Quran, this is linked intrinsically with Ramadan. So if we, you know, wanted to maybe catch up on reading Quran, then this is the month to do it in. Definition of fasting, if we come to that, we mentioned abstaining from eating, drinking, marital relations. It seems straightforward, but then the questions do arise. Somebody says, look, I ate something accidentally, or if I eat something which isn't a food item, does the fast break? And if I drink something, obviously the fast breaks, but what about if it's in the mouth, I'm using toothpaste or brush, gargle, does that break the fast or not? So then you get into the area of fiqh, Islamic law, which has been deduced by the scholars. Because obviously there's no verse, no hadith mentioning toothpaste and toothbrush. So what's the ruling on that? We'll come to that inshallah shortly. So the three types of fast, we mentioned the fard. Nafal, I mentioned Thursday, Monday. And there's wajib as well, which is that if you've made an oath, you know, I passed my exam, I will fast on such and such a day. There's another that becomes a wajib. So what breaks the fast? So this is where careful attention needs to be given, because many of the rulings which I'm going to talk about revolve around this understanding. What breaks a fast and what does not. The substance, whether it's liquid or solid, passes, for example, into the body's stomach digestive tract. That is the area where the tummy is, where the food is digested. So that starts basically from the throat downwards. So the mouth, if somebody gargles water, like you're doing wudu, that won't break the fast. But if it goes down the throat, that's when the fast breaks. So this is the key point to remember. And it should be from a normal orifice. A normal orifice of the body, like the mouth, even the nose. So if it passes through those normal body orifices, that will break the fast. The pores of the body, like the skin, there are small holes there, known as the pores of the skin. Water can pass through that. Like for example, a person has a bath or a shower, that will not break the fast. Even though the water does get absorbed to some degree, not a huge amount, but to some degree, and it's well known. But that doesn't break the fast. And there are hadith in this regard where I'll mention later on, for example, of Ibn Umar radiallahu anh, because of the heat, intense heat in Saudi Arabia, in Makkah, Medina, they would sometimes use a wet towel to wrap themselves in to cool down. So obviously that has an impact on the body, it cools you, and it also gets absorbed into the skin. But that doesn't break the fast because it's not a normal orifice. You can't construe that as drinking. And what is prohibited is drinking. We'll come to that again when I talk about the drip, intravenous, etc., and the smoker's patch which people put on the skin. You already should be able to understand what the ruling for that might be. So that the person is getting, for example, nicotine through the patch into the skin, the pores. So it's not going to be, breaking the fast. But I'll come to that shortly as well. So this is the key thing to understand, liquid or solid. So obviously that excludes gas. So gas, something which doesn't have a body, that will not break the fast. Sometimes we get questions, people ask, maybe an oxygen mask or a fragrance, something which person may be able to smell. So these are like water particles, etc. That won't break the fast because it's the part of the air. But if it's got a body, like smoke particles, so smoking will break the fast. So again, I'll come back to that. So the practice of the Salaf, the first community, people would gargle water. Part of the sunnah of the wudu, to gargle. And that does not invalidate the fast. Even though when you put the water in the mouth and then you spit the water out, there will be traces of water left. Because we know the Prophet ﷺ did wudu, it's part of the sunnah to do gargling, but you don't do gargling in an exaggerated way, the madmada, because then water can go down the throat and it'll break the fast. So you can do gargling and it won't break the fast. Likewise, using the miswak, to use the miswak doesn't break the fast. And note carefully here that even though miswak can have a taste, like it's got a natural taste or a flavor to it, so that still won't break the fast, because we know from the time of the companions, they would use miswak while they're fasting. They would do their wudu with gargling, without exaggerating it, and that wouldn't break it. So that practice is tawarith that we have inherited from the companions. It shows you it doesn't break the fast. Likewise, bathing. There are hadith in this regard as well. That does not break the fast. And that's where the ruling comes from, that the pores of the skin, even though water may go through due to the bathing, it doesn't break the fast, because the first generation would bathe, and there is no narration indicating that broke the fast. So this is important, because many rulings like the siwak relates to the toothpaste and the toothbrush, which I'm going to come to, and the gargling and the bathing, etc. I'll come back to as well. So let's move on to, for example, the inhaler. The inhaler has got an objective, which is a person's got asthma. They use the spray, which contains droplets of medicine. And that medicine is required to enable the person to breathe normally. So because it has a body, droplets, which you spray and it gets to the back of the throat and then it goes down into you, that will break the fast. That's why the ruling on using the inhaler is that if you need to use it, you are given the dispensation that, due to the illness, that you don't need to fast. However, the thing I would add here is, we'll maybe look at this in the Q&A section, is that if a person feels that the inhaler is, they can manage it, by just using it before the fast starts, and then at the end of the fast, they can try it. And then if they find problem, just break the fast and use the inhaler, and you have the dispensation that I mentioned at the beginning about marad, the illness. And I'll come back to marad as to what constitutes illness shortly. Likewise, a person using a suppository, open wounds and things like this, where if it enters into the back passage, or something is, some medication is swallowed past the throat, then that will break the fast as well. Because remember, the back passage links into the stomach area, so it's kind of an extension of the stomach, and the link there is going to break the fast. This is important because there are other orifices, for example, the front passage for the male and the female, which is not linked to the stomach. Another front passage for the male, front passage for the female isn't linked to the stomach. So that is where the fast won't break if you have some medication in the front passage. So for the man and the woman likewise. So that's important to understand. But the back passage, yes, the fast can break if you use a suppository or some other form of medication goes into the back passage, because that is linked to the stomach, the alimentary canal. Okay, so I've mentioned those points. From this point, you can also understand the fact that if a lady has a smear test, it won't break the fast, because sometimes they have some like some liquid or something which put into the front passage of the lady, and that can cause to go into the front passage will cause the fast to break. No, it won't, according to the correct opinion. And Sheikh Mufti Rafi Usmani has written on this in detail. He's the Mufti of Pakistan in Darul Karachi, where I was fortunate to study with him as well, where he's written on this point that it won't break the fast in the front passage. However, having said that, other scholars have given different views. So precaution is that to do qada, to make up the fast if a lady needed to have a smear test, for example. But there is that view as well that it doesn't break. But precaution is to just do the qada, but no kafara is applicable. That applies for somebody breaks the fast on purpose, and you have to make up with either 60 continuous fasts or pay charity for a poor person for 60 days. But I'll come back to the kafara later. Okay. Injection, people ask, for example, and I suppose the drip comes into this as well, where you have glucose drip, it's going into the vein, artery, etc. So, likewise, it will not break the fast because it doesn't go into an orifice, normal body orifice, it doesn't go into that. So, therefore, it's like the pores of the skin. To get it into the skin, this is not a normal way for something to enter into the body, so it won't break the fast. So that's like bathing and ghusl. Water enters into the body through the skin, it doesn't break the fast. Likewise, the injection, the drip, and the smoker's patch will not break the fast because it's on the skin and entering into the body through not a normal orifice. So hopefully that's clear. Anything not clear, inshallah, I can address in the Q&A. So if we just move on quickly. Eardrops, eye drops. People sometimes get confused here. The eardrop can break the fast because there is a link between the ear into the back of the throat. The eustachian tube, it does link. But the eardrum blocks that. So if somebody is healthy, they have a normal eardrum, having eardrops will not break the fast. But if you have a rupture in the eardrum, then that canal allows the drops to go into the back of the throat, and that is a natural orifice, it will break the fast. The eye drops are different. I remember once I used eye drops and you could taste the medication. You could taste it on the tongue because there is a link, but it's not a normal orifice, and it's like the skin pore. There is a very tiny hole in the eye which connects it to the throat, and anyone can prove that because you can taste it, the medication. But it still will not break the fast because it's not a normal channel for the eye drops to pass through. So we've covered that. And giving blood, nasal drops would break the fast. Good point. Doctor, I think, is whispered into my ear. Nasal drops would break the fast because it's a normal passage into the throat. So obviously, that will break the fast. Somebody did previously ask about giving blood, and to save life. Quran emphasizes the fact that a person saves one life, it is like saving the life of the whole of mankind. So to give blood, the ulama have given permission where it is to save life. However, bearing in mind that a person is fasting, is considered disliked if in Ramadan, if it causes you to become excessively weak. So that, unless it's an emergency, which is different. And so emergency is different. But if you're routinely giving blood to, then the issue is going to cause you to have become very weak. And therefore, you should defer that to after Ramadan, unless it's an emergency. Okay. There are different other illnesses like diabetes, epilepsy, stoma patient, etc. So the key thing to note here is that this is an area which is very sensitive. You get different types of diabetes, like type 1, type 2, where a person, for example, has got a hereditary problem. They've got from child, 2-year-old, 3-year-old has got diabetes because they've inherited that illness. So there's no cure basically for that. And if the person was to fast, they would cause themselves serious harm. And this is where in Sharia, they would be exempt from fasting. So that type 1 scenario. But type 2, where it's kind of a bit more fluid, because you can have a very mild form of diabetes, and to fast might even help you. But then you can have a more severe type where you may be needing injection, etc. And therefore, we would say that you need to get medical advice as to how serious the illness is. And that's why Dr. Atiq is here as well, and he will shed light on that aspect, diabetes. Likewise, epilepsy. Person can go into a fit if they don't take their medication. So Islamically, you are exempt if you are going to cause yourself ill health. And epilepsy, obviously a person can lose consciousness and they could, cause themselves real damage. Similarly, a stoma patient. I remember once I gave a seminar in a hospital in Birmingham, where the people who were stoma patients, and for anyone who doesn't know what stoma is, it's like a small aperture, a hole made into the stomach area, and they attach a bag. And the reason why they attach a bag is that the person can then collect urine and feces in the bag, and then they change the bag. Because maybe they've got cancer in the bowel or some part of the intestine, and so they can't function normally. So normally urine and feces passes out in the normal channel, but this person's got cancer there, so they collect it into a bag and then they change the bag, the stoma bag. So the question they were asking was, can we fast? And so we said straight away that look, the issue is really regarding how much it will affect your health. If you fast whilst you're ill with diabetes, epilepsy, stoma patient, etc., if it does one of two things, if it makes your health deteriorate, go worse, then you are exempt from fasting. Or if it makes your slow down in getting better, again you can have exemption from fasting in that. And I've just quoted 2 books there, Fatawa Shamia, which the ulama normally give fatwa from, and he mentions there that the ill person, khafa ziyada, that he fears that the illness will get worse. So you might be ill, and if you fast, it will get worse, then don't fast, in the sense that you've got like a legitimate reason not to fast, because you're harming yourself. And likewise, the person who is well and healthy, they fear that if they fast, they will cause them ill health. Again, there is scope there to be exempt from fasting. And likewise, that person might be ill, and then if they fast, it will slow down their recovery. Again, there is scope for a person to miss the fast, and then they will have to do qada of it and make it up. So this gives you an idea of how much leeway and mercy there is in the Sharia, that a person who is ill and he fears they might get worse, they can be exempt. Or that their recovery will be slowed down, again they'll be exempt. Now the question I just wanted to bring to your attention is, how do you judge? Because the word here says, khafa ziyada, he fears it'll get worse. So I fear something, you fear something, a third person fears something, whose fear counts? So this is where Dr. Atiq comes in. So we say that you get qualified Muslim doctor's opinion that if you don't eat normally or take your medication specifically, then your illness will get worse. The doctor's opinion counts as giving you information that you then decide, not the doctor, but you decide based on the doctor's information. Okay, if I don't take my medication, it's more likely than not, yani 51% chance that I'm going to get worse, then you are exempt from fasting. And if it's a less than that, like maybe 5-10%, then the other ruling applies, they're not exempt. So this is where you judge. One way of judgment is Muslim doctor's advice. Another way is from your past experience, tajriba. Like for example, last year, you were in the same physical state and you fasted and you became ill, or your illness became worse. So that's a proof in the Sharia that you can now say, okay, Dr. Saab gave his view, that's one evidence that it'll get worse. Another one is my past experience. And then the last scenario is, you don't have past experience, maybe doctor is not available, but your own ghalibul dhan, preponderance of thought, on the balance of probability, more likely than not, 51% chance that I'll get worse. Then that's the third scenario where you can make the judgment. It's a form of ijtihad that you personally make, where you don't have the doctor, but you can assess the situation, that okay, I'm going to get worse if I fast. Then you have the dispensation to not fast. So this tells you some ideas as to how to judge when not to fast. Medical advice, previous experience, and you can also do trial for the day. Trial for the day, you don't know, you're not sure, it's a 50-50 call. So you say, okay, I'll try the fast, and if I get into difficulties, I'll open the fast. So this is another practical way to assess your own situation. Take the medical advice, end of the matter. Your previous experience, go by that, end of the matter. Or you're not sure, and so you start the fast, and then if you got difficulty, you feel like, okay, maybe it's getting worse, the illness is or something, you're not happy with the situation, then you can open the fast as well. So trying it out, seeing how it goes. Just briefly, I'll mention here because time is moving on. The breastfeeding lady, pregnancy, etc., if they fear again that it's going to harm them, the lady or her child, then she can miss the fast as well. You now know how she will judge the assessment of whether it's going to affect her or her child adversely. It's based on what I just mentioned. Medical advice, previous experience, trial. So she can go with that and make her judgment accordingly for her own health and the child's health. And if she does open the fast or doesn't fast, then she does qada for the other time when she's out of pregnancy. Some exceptional cases, because sometimes people do ask about a surgeon. They got maybe long session of surgery, brain surgery or something. It takes 4 or 5 hours and it's very sensitive. And if they're fasting and they make slight movement because of weakness due to the fast, that can have serious repercussions for the patient. So the surgeon's exempt in that situation because of the nature of the hazard which is potentially going to cause another person, maybe even lose their life. So these are like exceptional circumstances. Exceptional circumstances. Likewise for other medical professions and even a driver. Somebody could be driving a coach, they got a long 10-hour drive. And if they're fasting, maybe they have a problem of concentration, they're 80 mile an hour, 70 mile an hour, then likewise there may be scope to open the fast based on the example I gave you 3 slides back. Take advice from a doctor or something, their previous experience. Maybe they did the drive and then they were losing control. So this is likewise for the pilot as well. I know in certain places they're not allowed to fast because of the fact that it's a safety concern for the passengers. That they have to, the pilot has to have eaten before the flight starts because it's a long haul flight and the like. And so therefore, there can be an exception for that. But it's all based on the specific circumstances, and we always advise to refer to a scholar to get advice on particular cases. But I'm just going through some general points. Just coming to the last couple of slides. Fidya and kafara, people ask, I put it in red here. 1.75 kg flour is given if a person can't fast and they're ill. Say they got type 1 diabetes, that's not going to go away. So next year is the same and the next year is the same. So they can't do qada because there's no other time when they're going to fast. So in that situation, they pay fidya, which is about £2.50, which is the equivalent for the 1.75 kgs of flour, or its cash value, which is what we give as fitrana on the day of Eid as well. Roughly about that. And kafara, I mentioned previously, is where if a person on purpose broke the fast. So this is a wrong thing to do, and so therefore there is a penalty for that, which is to fast 60 days in a row, because of the the emphasis in Sharia for the fast of Ramadan. Or if a person can't do that fast for the 60 days in a row, like Ramadan is 30 days in a row, then because they're due to their health or elderly age, etc., then they can feed 60 poor people the fidya, i.e. the 250 per person. Okay, that covers the points I wanted to mention in very brief. The key thing to remember, as I said at the beginning, inshallah, is that Ramadan, if that is good, then the rest of the year is good, inshallah, as well. Because that prepares you for the rest. As my Sheikh Mufti Taqi Usmani would say, that, this is like a overhaul of the, things that have accrued in the year. You've done bad deeds, you've had mistakes you've made with your family members or other people. This is a time to renew and, get rid of all those effects of the sins. So this is that purification for the year. And if the Ramadan is good, then you're set for the rest of the year, inshallah, as well. And with those few words, we'll pause here, inshallah. Wa sallallahu ta'ala ala khairi wal Muhammadin wa ala alihi wa sahbihi ajma'in. Okay, Hafiz Sahib.
Jazakallahu khairah. I'm not going to really take any more time. We're going to move on straight away to the next presentation. Just a reminder to the brothers in the masjid and sisters, if any, you should have access to slips of paper. I think there's some young lads walking around with pieces of paper. You can pencil down your questions now, inshallah. We don't have so much time. We will try our best to get some of these questions answered, inshallah. Jazakumullah khairah.
Assalamu alaikum wa rahmatullahi wa barakatuh. Hafsab, is it better that I quickly finish, and because I think we'll get more from the Q&A session. I know there's 20 minutes. 10 minutes. Okay, I'll do 10 minutes presentation, and if brothers can start thinking about the question what you want to ask and maybe jot down on the paper, that will become easier. Because obviously it's not just 20 minutes talk, it's quite a lot. But Mufti Sahib, mashallah, had elaborated very eloquently in terms of the do's and the don'ts, and it's covered the rule of thumb. So why are we discussing about the chronic diseases? I mean, I've been involved in diabetes guidelines for patients with diabetes for the last decade or so. We've been doing it for the last 5 years in this masjid, and alhamdulillah, today is the best audience we've had. It's just because people are very keen to fast in spite of having chronic disease and diabetes per se, which Mufti Sahib said. And BIMA have released guidelines for all chronic diseases: diabetes, ischemic heart disease, obesity, chronic kidney disease. So if somebody is interested, if you just put British Islamic Medical Association guidelines, we were involved in this, but it gives you more detail. To cover everything in 10 minutes becomes slightly difficult, but I'll briefly go through. I mean, it's not common sense in terms of the physiological effect of fasting. Everybody is fast as well. Other religions fast as well. Generally, if you look at in terms of the other religions, whether they are Jews, Christians, some of the Hindus, they fast differ, but basically those religions also are fasting. And this has taken, in terms of a lot of 5-2 fasting for medical reasons, it has really kicked off significantly. So there's a lot of medical research which shows that people who fast regularly have got benefits, not only spiritually, but physically as well. I'm not going to go to the spiritual aspect because Mufti Sahib has covered it. In terms of physiological, first of all, the blood glucose. So automatically we know that even a healthy person fasts for a long duration, the blood glucose levels start dropping. But patient with diabetes, again, I will probably elaborate because it is my field in terms of who should or shouldn't fast. But there's enough scientific evidence to show that people with diabetes as well, it's beneficial for them because their blood sugars drop. In addition, it lowers the cholesterol. But there is a caveat to that. There was a study in Pakistan a few years ago where they looked at patients' body weight before fasting and after fasting. And guess what? 2/3 of the patients put on weight. Now we all personally analyze, and I probably, basically one homework we can all do, or one thing. On the first day of fast, you start to weigh your weight. And you weigh yourself again after 30 or 29 days of fast. I think we all, majority will be surprised that we have gained weight instead of lost weight. And you ask somebody, said, it's the barakah of Ramadan. It's not the barakah of Ramadan, but the barakah of Ramadan is just not eating. But I think it's the wrong notion that I think we need to eat more. And generally we eat the wrong food as well. We all still think that if we don't break our fast with samosas and pakoras, our fast is not valid. It's wrong. I think we should, if one thing you can take home from this meeting is when you break the fast, avoid fizzy drinks, avoid oily food, the fried foods. I know as we speak in our houses, there are plans of making samosas and pakoras, but generally avoid it. You will notice the difference in terms of your weight as well, and you will also feel healthy. Detoxification, again, there's a lot of scientific evidence. Everybody needs rest, so our body needs rest as well. So during the month of Ramadan, we all have accumulated toxic burden throughout the all 11 months. So those 1 month of fasting really helps you in terms of reduction of toxic substances. I think the notion we give, like Mufti Sahib mentioned, imagine I am used to 10 cups of coffee a day. So what do you do just before Ramadan? You start to wean off your coffees, aren't you? Because otherwise, the first day of Ramadan, you'll have a stinking headache with the withdrawal symptoms of caffeine. So similarly, I think people with chronic disease should analyze themselves in terms of the personal experience. But mock fast is very, very important. I mean, I had a couple of years ago, a very eminent scholar rang me, obviously was visiting here, at 6 o'clock at Asr time, they rang me up that his blood sugar is 4. He was a diabetic patient on insulin. And imagine there's 1.5 hours needed to break the fast. His blood sugar is 4. It was very difficult to convince him to break the fast, but we managed to obviously keep checking his blood sugars every 15 minutes, and he didn't move a muscle just because he didn't want the blood sugar to fast. And alhamdulillah, we could manage that he would break the fast appropriately. But these things happen, and the people don't want to break the fast because of the guilt feeling, which normally happens once you start fasting. Imagine you fasted for 15 hours and there's 1 hour to go fast, and somebody's got diabetes on insulin, and the blood sugar start dropping. It's very difficult. But then if you have started mock fasting, 15, 16, 17, normally 13, 14, 15, Shaban people fast, start fasting and make plans. So if you're on insulin, I think you need to change that in terms of when you take. If somebody is taking insulin once a day, we tend to then move from suhoor to iftar. So it's more easy because after you break your fast, you're eating and drinking for 5-6 hours before you get. So you can always adjust your blood sugars. Similarly, if you're on a medication which drops your blood sugar, there's only one medication which can drop your blood sugar, which is sulfonylurea, glycoside, which is the common tablet which people take. Nowadays, because of the new tablets, we don't tend to prescribe that very commonly. But that's another, again, if that person is supposed to take, we need to discuss with your health professional whether we need to cut down the medication, or if you are supposed to take it, move that medication at iftar time. So it's become more easy to manageable. So these are some of the changes where people need to consider, but people need to consider in advance so that on the first day of the fast, people shouldn't have the guilt feeling and they should be able to confidently fast without your blood sugar going down or up. And this holds good for other chronic disease, hypertension, chronic kidney disease, heart failure, ischemic heart disease, obesity and so on. Obesity, again I mentioned, there are so many harms of obesity. People really, you still start to wonder why people do not give importance to it. I mean, it can cause stroke, it can cause heart disease, type 2 diabetes, depression, problems with sleep, and so on. And Ramadan is the best time where if somebody wants to lose weight, you could lose weight. On an average, people lose weight 3 to 5 kilos, and it's a wonderful opportunity for patients or people who have got problem with the weight to consider lose weight. Because during fasting, you start to burn your calories. Normally, you utilize your carbohydrates to burn your calories. But once somebody fasts for 8, 10, 12 hours, they start in terms of using their fats as a constant in terms of source of energy and starts to burn the fuel. And you will notice that's one of the reasons why people start to lose weight. Fasting also causes your stomach to shrink. And this was evident on the first day after Eid. So somebody has fasted for 29, 30 days and they've fasted appropriately, they've eaten as you're supposed to do with sunnah in terms of not filling the stomach till the throat. And then on the first day when you start to eat, you can't fill the stomach on that first day because your stomach has shrunk. So 29, 30 degrees, you really trained your stomach to eat less and automatically your stomach is trained. And the first day when you start eating, it becomes very difficult. So, and also the things which you want to introduce in terms of your lifelong, the best time to introduce in Ramadan. Like Maulana mentioned, that even the good things we introduce in Ramadan, hopefully it will stay for the rest of your life. And in terms of diet, briefly going through, generally speaking, more of fruits and Mediterranean diet. So more of fruits and vegetables, more of whole grains and fiber, more of fishes, and less of the saturated processed food. Normally we have the junk food, and that's one of the reasons why we haven't treated you with pizzas after the talk, because obviously it was something to do with the diet in Ramadan. I was joking about that. In terms of the oils, I think it's not moving properly there. Generally, if you look at our houses and our kitchens, what we normally use, we use some of these daldas and cooking oils. Generally, we need to tend to avoid. If you use more of the healthy oil, unsaturated fat, especially the olive oil, rapeseed oil, these are more health conscious compared to the ones which we normally use in our houses. And also the amount of oil as well. I think especially some of the houses, I think there's more oil than curry. And that obviously causes more indigestion, which is very, very prevalent in people during Ramadan, because you fasted for the whole, so your acids are secreting in your stomach. And then when you start eating all these fast fried foods, you automatically get reflux, and you notice in Taraweeh, obviously people burping, and you feel very uncomfortable standing next to them. I've mentioned about fruits and vegetables. Generally, you want to fill up with those foods which makes you feel longer, especially in terms of fibers and oats and beans and pulses. They tend to help you and also help to lower your bad cholesterol. I mentioned the fruit and vegetables. I'm not going to go in detail about it. Salt, hypertension is such a prevalence in our communities, and I think especially this, we need to really measure and we put the salt when you put in, rather than just chucking 2 or 3 spoons in our foods as well. And smoking, Maulana mentioned about the nicotine patches. Smoking causes more death than lots of other illnesses, which is surprising. So basically, I think Ramadan, lots of people when they come in, especially we have patients in the 40s and 50s coming with heart attacks, and the day they have a heart attack, but they see the impending death, they pack the smoking just like that. So the motivation and all the other things come straight away. But all the time you start counseling them, it's very difficult to fast. So when you have gone through fasting for 12-15 hours without smoking, it is easy for them to completely stop smoking for the rest of their life. And boosting brain function, we know that antioxidants tends to be built up in patients who are fasting as well. So I think it's another way of, in terms of helping your brain functions, especially when somebody is fasting. So your concentration and energy of fuels are utilized in your brain rather than in your body, helping you to digest. I'm just going to leave this for the time being, and in terms of spiritual detoxification as well. Generally, I think probably in summary, fasting is a healthy non-pharmacological means of improving your cardiovascular risk factors. And it's an opportunity to not only improve your spiritual health, but also your physical health. It's a golden opportunity to quit smoking. And patients with diabetes and other chronic illness should have a pre-Ramadan review, ideally about 2 weeks before Ramadan start. And then generally we try to be healthy spiritual role models for others, so that people can look at you and obviously embark on good practices in their lives. So inshallah I'll end that, because I'm aware of the shortage of time, so we'll probably address some of the questions which we have got.
Bismillah ar-Rahman ar-Rahim. We have just a few minutes before the Isha Salah, so I'll just mention some of the questions, and then maybe we can look at input from Dr. Atiq as well. One point was about the asthmatic person, that if they break their fast due to the inhaler, will they have to make up the fast? Yes. Like any ill person, they already have the dispensation, but if they tried to fast and they couldn't carry on, they break the fast and they do qada of it at another time when they are well. The other person asked that if you go past someone smoking and you breathe the smoke, will this break your fast and will you have to make up for it? Yeah, so we mentioned this point, that if the object has a body, so like a spray, fragrance, smoke has a body, then that will break the fast. So you have to avoid the smoke and things like that. Even like, the ulama discussed that rain, like a heavy rain or something like this, and you end up swallowing it, that can break the fast. You You have to be careful, but there's no kafara. You just have to do qada of it. So you be careful with that aspect as well on the smoking. Then there was an issue which was mentioned about type 2, type 1 diabetes, dangers of starting with a high glucose level at suhoor with the intention of being able to maintain fast till iftar. So this is where the doctor's advice is important. Can you do that without risking your health? Because it's a long day, the clocks will be moving shortly, and fast is going to open at 7:30, 8 o'clock in the evening, starting at 5 in the morning. So it's a long day. Fine, you can do it for 1-2 days. Because of the diabetes, it might catch up with you. So this is why it's important to take medical advice or your previous experience, or you try it out and see how things go, and then accordingly. But medical advice is important in diabetes because there is a danger the person could lose consciousness because it goes really low. Dr. Atiq can maybe elaborate on that. I'll just take a couple of more points here. It says, what foods are best to eat at suhoor? I think Dr. Atiq alluded to that. Last couple of things and then we're done. If you visit a dentist and they're cleaning, will that affect the fast? So the thing is, as I mentioned, if it goes down the throat, that will break the fast. Toothbrush should be avoided in Ramadan because there's a hadith mentioning that the khulufus sa'im, which is the breath of the fasting person, there's a reward regarding that because it's evidence that you're fasting. You haven't brushed your teeth. But sometimes it could be the case you're going for an interview or you're dealing with somebody at close quarters, and therefore you could use the toothpaste, but you'd have to lean forward and make sure nothing goes down the throat, because if it does go down the throat, then that will break the fast. So avoid toothpaste, toothbrush, but if needed, then it wouldn't be makruh. Otherwise, is to be avoided. Okay, youngsters, if they go swimming, accidentally swallowing, if it goes down the throat, it will break the fast, but if they swallowed it and they spat it out, it won't break the fast. Last couple of things about, I'll leave that one to you. Okay, diagnosed, with some syndrome, I'll leave that for you as well, and suffering from Parkinson's, I'll leave that with you. Down the throat. So vomiting, the ulama do mention if it's gone to more than a mouthful. If it's a small amount, then it's part of, like food is in your tummy already from that as well. But if it's full mouthful, then that will break the fast as well. I think there was one more point I just mentioned about the drip and the injection. It doesn't break the fast because it's not a normal orifice. Then the question was that type 1 diabetes should be okay with the drip glucose and insulin. So the point here is that they're exempt from fasting. But if somebody wanted to fast because you don't know, Allah protect us from that situation, the person might be about to pass away. They've only got a day or 2-3 days to live. They're going to pass away anyway, and they want to fast, and they've got a drip, and they can get insulin and they can get glucose. They can fast if they wanted to, but they're not required to from an Islamic perspective.
Jazakallah. I think just going on the type 1 diabetes, I think there are guidelines in terms of low risk, medium risk and high risk. Patients with type 1 diabetes are in the high risk group, but there are newer insulins at the present moment which are much better than previously. So normally I think the rule of thumb, as Maulana mentioned, is if the fasting is going to worsen the illness or is going to be life-threatening, the best not to fast. But people have fasted by changing the insulin. But individually, I would normally recommend. But if somebody wants to take a drip and then so why complicate things when Islam has made it easy for you? Second thing, in terms of after being diagnosed, I've been prescribed apixaban 2.5 milligrams every 12 hours. My GP says I should not fast and I cannot take this medication every 12 hours. 12 hours, it shouldn't be 12 hourly. It can be 14, 15 hours. So one before at suhoor, one after iftar should be fine. But make sure that you don't get dehydrated. Last one, patient diagnosed with Brugada syndrome, inherited cardiac condition, advised the consultant not to fast due to dehydration can increase blah, blah, blah. The consultant was not a Muslim. Again, I think personal experience is normally, I say, is basically when you mock fast, you gradually increase the duration of the fast. You don't have to be all 12 hours, so you do it 4 hours, 6 hours, 8 hours, and you analyze for yourself. And if you feel that you can manage it safely, then I think you should go for it.
Okay, just one clarification. If you don't have a Muslim doctor to take advice from, which is the best scenario, a normal non-Muslim doctor, reliable one, is sufficient as well. Because the objective from the medical opinion is to give you information as to whether to fast or not. And so that information is valid even if it's from a non-Muslim. So it gives you an idea that, okay, I'll be endangering my health if I fast, so that's sufficient. But obviously it's better that you have a Muslim doctor. Okay, Jazakallah.
Jazakumullah khairah for everyone taking part in the masjid or online. Just to remind you, this whole program was live streamed and it is saved, recorded. So if you visit the website, the YouTube link for the masjid, you'll see this saved and you can watch it again, inshallah. If you still have some questions, you can send an email to the masjid. Dr. Atiq is resident at the masjid, he's a local, and Mustafa is also accessible. We can pass on the questions and hopefully get back to you. Jazakumullah khairah.